We start in Mozambique this hour, where there has been a warning of a growing threat of diseases such as malaria and cholera. This, of course, happens in less than 2 weeks after Cyclone Idai hit Southern Africa countries. The government in Mozambique has set up prevention and treatment centers to deal with cholera in the districts affected. As floodwaters recede, people are in urgent need of food, shelter and medicine. Displaced residents have been accommodated in temporary shelter at the Samora Machel School. Cyclone Idai lashed Beira with winds of up to 170 km per hour, then moved inland to Zimbabwe and Malawi, flattening buildings and killing at least 656 people across the 3 countries. And for the latest on this story, we are now joined on the line from Beira, Mozambique, by MSF Emergency Coordinator Gert Verdonck. Gert, good afternoon to you. Thank you so much for coming through. Just give us an update. How is the situation on the ground currently?
Well, the situation at the moment, the sun is shining for a couple of days now, so the water is receding in most of the places. So we're starting to see how big this catastrophe is, and so what impact it has on the health system, especially for us as MSF, where we are implicated in. The huge are very big. As you mentioned, it's food, shelter, water, everything was down, and it's a big town and it's a big area, and it needs to be started up again. So there's a big disruption of all the systems, and within the coming weeks we will go from one step to the other and seeing what comes on our way, and we will try to tackle the problems one at a time, because this catastrophe will still last for a bit, even though the hurricane or the cyclone and the floods are gone now.
Now, what are some of the challenges with regards to the rescue mission? We are getting reports that there are still people who are finding shelter on top of the trees and on the roofs of the houses. So talk to us about the rescue missions.
So the rescue missions were mainly based in Uzi, which was completely flooded. It was an area of more than 125 square meters that disappeared from the surface. They have been taking people out with helicopters and bringing them to transit centers in Beira, where they have been hosted, provided with shelter, food, and all these kind of needs. But the big population is living in some bigger cities like Dondo and especially Beira, which is the capital of the province. A lot of the houses are destroyed, so when it rains inside. This will create respiratory tract diseases, food supply, which normally comes by road. This system is completely disrupted, so people are in dire need of food. The water was also down, the water system, the national water system. They made a big effort, and at the moment it is back in most of the places, but of course there is damage in their system, so it will take some time also to start, to make everything perfect again. But water, if you don't have clean water, it has a big implication on everything that is health. Communication means are back. Luckily, this will facilitate all the actors on the ground to communicate a lot easier and to go to the places where before there was no information. Now it's easier to communicate. It's easier to go around, and we find little by little the devastation that the cyclone has caused.
Yeah. But from what you're seeing there on the ground, are there enough plans in place to deal with a possible outbreak of any waterborne diseases? There are reports now that there might be a possible outbreak of cholera.
Yeah, as I said, the water is essential. No clean water has a big implication on the health system. We see a an increase of acute watery diarrhea for the moment. We see a lot of infected wounds. We see skin diseases. So this is what we try to prepare now. But as a support of the Mozambican Ministry of Health and the health system, we try to support them so they can restart the normal system, and we try to be of support for all the other new needs that pop up, which you normally don't have when everything is functioning.
All right, Gert, we have to leave it at that. Thank you so much for coming through. Gert Verdonck is an emergency coordinator at MSF, joining us live from Mozambique, and really saying what Dr. Borat told us earlier on, that the situation remains quite bad in Mozambique.